we're here today to really take into account and assimilate all the latest evidence from various S3 level guidelines, delivering better oral health, a whole host of formats which have changed the way we think about biofilm mediated diseases, specifically periodontitis and caries. Because there's an awful lot of misunderstandings out there within the practicing community. So we've brought together the leaders of the different national societies to reach consensus on what the evidence, the current evidence tells us, and how we convey that current evidence and cascade it down through our societies to the profession.
A lot of interesting conversation and opinions, and yeah, you know, it's just been really informative and probably made me think a little bit differently about how to deliver care and prevention as well.
It's been brilliant meeting peers, colleagues, friends. It's just been really important knowing that what I'm doing as a dental therapist at the University of Liverpool in terms of my role in academia is actually being validated. It's sort of reaffirming what I already know, also learning new things, but it's just really interesting to see what the global landscape is in regards to non-communicable diseases and oral health. So that's really, really important. But it's been fantastic. It's been an absolute cork of a morning.
We're looking at the general, if you like, burden of oral disease in its various forms and trying to understand better how, from understanding the sort of fundamental basis of those diseases, how do we address them? So we're looking at some really quite profound issues.
What it's made me realise is that everyone in that room agrees with each other. It's refreshing to be in a room where no one is arguing the point. We're all thinking the same thing, we all agree on what needs doing, but also how much passion I still have and I can see that others have to drive change.
One of the most important take-home messages is that we wait until disease happens and we treat disease, but yet we want to prevent disease. And there's different levels of intervention we can make, and one of the most important ones is when we have gingivitis, but we don't ignore it. Actually, it's very important because if we treat that inflammation and we improve that plaque control, we prevent periodontal disease, we prevent caries. We've got to make an intervention there and make sure if we get that right, then actually we help preventing caries, number one, and then periodontitis, number two, and we're improving the health of our patients and preventing them from deteriorating and getting worse.